Hi everybody, this is Dr. Amit Verma from Dr. A.V. Cancer Institute, and this month is celebrated as a lung cancer month, and we are going to talk about the lung cancer today. Lung cancer is one of the leading cause of cancer in India, and this can be considered as one of the big burdens in India as of now. Almost 6% of total cancer is attributed to lung cancer, and total number of cancer death, 8% is contributed by the lung cancer. Lung cancer is common in males as compared to females. It is associated with tobacco smoking, that is cigarette smoking, and there are common histologies like adenocarcinoma, squamous cell carcinoma, small cell carcinomas, and others. Adenocarcinoma are the common histologies seen in lung cancer. We have seen a lot of change in the treatment paradigm in lung cancer in the past 2 decades. The overall survival of lung cancer have increased from past 8 to 12 months to 4 to 5 years in this past 2 decades. And this has happened because of the new paradigm shift in the treatment based on the target therapies and the immunotherapy. Patients who are eligible for target therapies benefit to all these treatment based on the identification of a specific gene mutation, or what we call as driver mutations. And we have plenty of target therapies available for the lung cancer patients these days. We have very specific biomarkers to be tested in lung cancer, like EGFR, like ALK, like ROS, PD-L1, MET, RET, HER2. These are the common biomarkers what we normally do. There are certain biomarkers which are tissue agnostic, like tumor mutation burden and anti-RK fusion. There are a couple of other biomarkers which are into the experimental phase, like PIK3CA and others. So, having said that, identification of these tumor biomarkers is either done on the tumor biopsy using the technology called next generation sequencing, and in patients where the biopsy is not feasible, it is done using a blood sample called liquid biopsy. Both these tests identifies the driver mutation and makes the patient eligible for all these new drugs. When we do these tests in up to 50% of times that you may identify these biomarkers, so that is 1 in 2, the patients are eligible for these target therapies, which will make a shift in the overall outcome, that is the better outcome. Having said that, the lung cancer is a challenging cancer, but we have a lot of options for the cancer patients, even post-progression. On the treatment, when the patient progresses, we have technologies to identify the reasons for progression, and we have certain drugs called second generation or third generation drugs to overcome them. Having said that, the overall outcome of the lung cancer is far better than before. We have a lot of clinical trials running in India where we are using the newer drugs for our cancer patients, which have been very useful. Cancer, especially lung cancer, can be prevented by modifying the lifestyle, especially avoiding the first-hand smoke and the second smoke. Both these things are very detrimental. Even if you quit smoking, the chances of having lung cancer still remains even in the future. As of now, lung cancer screening is offered to patients who are exposed to a lot of smoking habits or are exposed to any kind of toxic pollutants. So with that, this Lung Cancer Awareness Month is going to bring a lot of information to all of you, and I wish good luck, and I wish the cancer-free India. Thank you very much for your kind attention. Have a nice day. Bye-bye.